Morning, everyone. Thank you for joining me today. First and foremost, I want to offer my sincere condolences to the many families who have lost a loved one to COVID-19. This past weekend was, I think, the most difficult yet in respect to the death of a Manitoba boy under the age of 10. This is truly heartbreaking, and our thoughts and prayers go out to this boy's loved ones and everyone who's lost a relative or friend during this unprecedented time. COVID-19's handed us some new challenges, that's putting it mildly, and they're greater challenges than most of us have ever dealt with before. And it's challenged each and every one of us to become more resilient and more innovative and more determined than we ever thought necessary. Our government's number one priority has been to protect our most vulnerable citizens and to make sure that our healthcare system's there for Manitobans when they need it. We made some good progress, and we're going to continue to make progress as we face these challenges together. Notre priorité numéro 1 dans cette pandémie est de protéger nos Manitobains les plus vulnérables et de veiller à ce que notre système de santé soit là pour tous les Manitobains quand ils en ont besoin. The recent surge of cases is very concerning for all of us, as our healthcare system continues to be stretched and strained. And that's why nearly 3 weeks ago, under the direction of Dr. Brent Roussin and our healthcare leaders, we implemented new public health measures and moved all of Manitoba to critical or red on the pandemic response system in order to halt the spread of this deadly virus and to bend our COVID curve down. However, despite those orders, which were the strongest in the country, and the firm recommendation from Dr. Roussin, from our healthcare systems, from our government and myself to stay home, some were going against the spirit of the rules and creating a greater risk to public safety, which is why nearly 2 weeks ago we announced even stricter measures to further limit gatherings and retail operations. Those rules are necessary to halt the spread of this deadly virus, and we recognize the significant personal and professional sacrifices of Manitobans, most Manitobans have made in the face of this pandemic in order to protect themselves, their loved ones, and their community. The vast majority of Manitobans are doing what Dr. Roussin's ordered. They're following the fundamentals, and that's important, and I thank them for doing that. I thank you for doing that. Keep up the great work. But there is a small minority of people and organizations who are not doing their part, and in doing so are putting the health and the health of others at risk. And that's unfortunate, but my message is clear. There will be consequences for those who disregard the public health orders and put the health of others at risk. And that's what I'm here to talk to you about today, to give you an update on enforcement. In all, 100 tickets were issued across Manitoba last week. They total over $180,000 in fines. This is a slight increase over the week prior, and you'll recall that our enforcement teams issued 95 tickets. It is noteworthy that approximately 20% of those tickets issued last week related to gathering sizes, including one gathering in rural Manitoba that police described as having more than 15 people involved. It's critical right now that we do not gather with people outside of our households, and we need the full participation of all Manitobans in order for these strict public health measures to work. It's incredibly disappointing that anyone would blatantly disregard the public health orders in place to protect Manitobans. Enforcement officials have issued tickets for events that took place at 2 churches over the weekend, and these events are currently under investigation. Additional tickets are expected to follow. I remind everyone that you don't have to believe in COVID. COVID believes in you, and COVID kills. Additionally, I have an update for you on the rally that was held in southeast Manitoba on November 14th. In all, approximately 30 tickets have been sworn, and we are still investigating additional tickets for individuals who participated in this rally. I want to emphasize that peaceful protest in a democracy is a right, but today's public health and emergency orders matter more because they protect an even greater right, the right to life itself. This rally that I referenced earlier and other events put public health at risk for everyone who attends and everyone who comes into contact with those who attend thereafter. So again, I would say thanks to everybody who's working hard to stop those who are disregarding public health measures, including all Manitobans who are calling our tip line. And a reminder to everyone, if you see something, say something. Report it to our tip line. You can contact the tip line to voice concerns and share information by calling 204-945-3744 or 1-866-626-4862. That's a toll-free number, and you can press option 3 on the call menu. You could also go online if you like to www.manitoba.ca/COVID-19, and you can complete the reporting form that's online. I want to also say thank you to our enforcement partners for stepping up and helping Team Manitoba do everything that we can do to halt the spread of this virus and protect our most vulnerable Manitobans. This past few weeks has not been easy for any of us, and I am confident that if we continue to work together, we can and we will get back to beating COVID-19. The best thing we can do for our small businesses, for our healthcare system and those who work so hard within it, for our schools and our teachers and support staff, for our students, for our vulnerable communities, for our friends and our family, is to bend that COVID curve down. And this is a team effort, and we all have a role to play in protecting ourselves, our loved ones, and our community. And we did it once, and we can do it again. But we need everyone on Team Manitoba. When we were abiding by the fundamentals, we were beating COVID, and some of us lost our way. Now COVID is beating us, and we need to get back to the fundamentals and flatten our COVID curve now. Lorsque nous respections les fondamentaux, nous battions COVID. Alors certains d'entre nous ont perdu notre chemin. Et maintenant, COVID nous bat. Nous devons revenir aux fondamentaux et piller notre curve COVID maintenant. It's crucial we follow the fundamentals. Stay home, leave your home for essential purposes only. Stay home when you are sick. Stay home if any member of your family is sick. Don't socialize with people outside of your household. Wash your hands. Cover your cough, practice physical distancing, wear a mask, be kind, support one another. This is a very, very hard thing for so many of us. Just a smile, a word of encouragement can make a world of difference. Thanks. I welcome your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question this morning. Up first from CJOB, Elisha.
Good morning, Mr. Premier. In the spring, your approval rating numbers were low, and when we asked how you felt about them, you said you'd rather be hated and have low COVID numbers. So to use your vernacular, you are now hated and have higher COVID numbers, some of the highest in the country. Why do you think your approval numbers are so low?
I think people don't like COVID, and that's fine. I'm fighting COVID, and I'll continue to stay focused on fighting COVID. The reality of my situation and our government situation is that we're totally focused on that challenge, and that's where we'll stay.
Have any MLAs tested positive for COVID, and would the province tell us if they did?
No and yes.
From the Winnipeg Sun, Josh.
Good morning, Mr. Premier. As you alluded to in your preamble, it's been about 3 weeks since the enforcement has really been stepped up by the province. Are you guys seeing that pay off in terms of lower contact rates, or are you seeing that be an effective means of, as you put it, bending the curve downwards? Are people actually starting to listen to these orders now that they see things are being enforced?
I'd say it's a little bit early, Josh. I'm hopeful that the message is getting out there that we're serious about enforcement, because in the absence of it, it doesn't I don't think it does anything but encourage some people to actually just continue with behaviors that endanger the rest of us and them as well. But I think it's a little bit early to draw any conclusions. I know our enforcement people are working hard, and I know that unfortunately there is a lot to enforce. So we're going to continue to take the issues seriously. We haven't been going in a good direction, as you know, for the last couple of months. And so there's a real necessity to maintain enforcement around the public health orders that Dr. Roussin has recommended and get everybody on the team.
All right. So my follow-up, I believe it said 22 tickets were issued to businesses or organizations. Obviously, I think there are 2 issued to the church in Steinbach and 1 at the Springs Church. Are most of these 22 tickets to churches or similar business or organizations, or are you still seeing a lot of retail and other businesses like that are being issued the $5,000 ticket?
There's 22 tickets went out to businesses at the $5,000 level. 48 were the $1,296 ticket for individuals for various offenses. 23 of the 300 or 298, I guess I say $300 tickets, but it's 298 actually for failure to wear a mask in indoor public places. And 7 were also issued by Manitoba First Nations Police Services. So there's a bit of a breakdown there, Josh.
From CBC Radio Canada, Abdoulaye.
Hi. Angus Reid Institute survey today, it's showing you are on the least popular around the country. Could you please comment on this, and what kind of message does that send to you?
Basically, it tells me that people don't like COVID, and neither do I, and we'll stay focused on fighting COVID.
I'm talking about the Angus Reid Institute survey.
From CBC Manitoba, Bart.
Hey, Mr. Premier. What is the province going to do about municipalities like Hanover that will not take part in enforcement efforts, and other ones that say that they don't have the resources or won't on principle?
I don't have the right in front of me, Bartley. You know, we offered encouragement to the RMs, had quite a bit of uptake. I think we could get you that list. And we'll continue to encourage others to step up local enforcement by partnering with them, offering them funding support. I just use this occasion to remind people who in some areas it seems don't take this seriously that our test positivity rate a month ago was 8.8 and now it's 13.4, that our COVID cases reported has almost tripled in the last month. 64% of all our cases happened in November alone. And we know that we had very low case numbers for much of the year because, well, maybe partly because people were abiding by the rules and partly we were all outside and there's lower risk being outside. But I would say to people, we're approaching winter. The temperature is going to go down. The likelihood of people being in close quarters and inside is going to, I think, be a negative factor. Dr. Roussin says it's one contributing factor. So I want people to take this very, very seriously. We have a chance to do the right things here, follow these orders, save lives, and I really encourage people to do that. 76% of our COVID deaths in Manitoba were in 1 month, last month. Now we're in a position where we can change these things for the better in December, and I think that would be the best holiday gift for all of us that we could possibly come up with.
Okay, Mr. Premier, no one's denying those statistics. My question, though, I'm going to repeat it, is what is the government going to do about these refusenick municipalities that refuse to, they don't just not enforcing, they're refusing to enforce pandemic violations?
Well, I'd emphasize again, Bartley, we have literally hundreds upon hundreds of inspection people now empowered, and municipal would be a nice support if municipalities will buy in, but we'll be enforcing in municipalities just as we did this past weekend, whether they have municipal officials there or not. So I would emphasize to anyone who's out there thinking that they can get away with something in one RM because there's nobody from the RM enforcing, that there are other people who are certainly willing to do that and are.
From the Canadian Press, Steve.
Premier, the daily COVID count numbers seem to have plateaued recently. They're no longer rising, but they're still at quite a high level, as Dr. Roussin has mentioned in recent days. Because they're not going down, perhaps as quickly as some expected, are you looking at continuing the restrictions beyond the 1 month that was originally envisaged?
Steve, I'm going to, as always, I'll defer to Dr. Roussin and his advice on these issues, but I'll tell you my gut feeling. My gut feeling is that as we get into winter, it's going to be critical that we continue with a high level of restrictions for some time. And I would encourage Manitobans to understand that. I've been accused of being the Grinch. I'm unpopular according to Angus Reid. I'm more popular than I was according to the Leger poll. I prefer the Leger poll to the Angus Reid poll. But the fact is, it isn't the poll that matters to me. What matters to me is that we beat COVID, and that's what we have to stay focused on as people. And so I don't think that's going to be a short-term undertaking. People are talking about a vaccine with hope, and I'm with them. I'm hopeful too. But let's understand something. It's not here yet. And even when it comes, according to the little information we're getting from the federal government, it's going to come slowly. So it's really, really important that we keep our guard up, not down. And it's really important that we understand that this is not going to be a short-term deal. I think that if we get into that frame of mind, take this seriously, as much as it's hard on all of us, we'll have the chance to turn it around, and then we can spring into a positive situation come early next year. That's our hope. The numbers will be what they are, and Dr. Roussin's advice will be followed as it has been.
And you mentioned that most people are following the guidelines and the public health orders. There are small numbers of somewhat high profile and very vocal opponents of the public health orders. Did the government underestimate, or perhaps did the government overestimate the willingness of the public to abide by public health orders? And did the government not drive home the message about not socializing hard enough?
I think there's always room for that sort of hindsight evaluation. I mean, we did that Ready, Safe, Grow exercise in the summer to help people in part remember the fundamental messages. We spent about 2/3 of our budget promoting this with ads and radio ads with Dr. Roussin talking about hand washing, about the need to reduce your contacts. We started those messages fairly early, Steve, but you know, the question is always, did people take it for granted because our numbers were so low? And I think in part that might be true. We might be in part the victims of our own early success as people in not getting COVID and not transmitting it. But we're in a different situation now. Everybody knows that. And so Manitobans can adapt, and Manitobans can rise to challenges. We've done it before, we can do it now. And so I keep believing in Manitobans. I'm not going to stop.
From CTV Winnipeg, Jeff.
Hi, Mr. Premier. Just if I could ask you a question back to the Steinbach rally. 30 tickets and maybe more coming. Can you give us an update, though? You said a couple weeks ago that charges could be coming. Can you give us any kind of update on that?
All I can say, Jeff, is I know there's investigation continuing on that, and I expect on a couple of other events as well. And so I am not going to interfere in the police or enforcement officials doing their job. Their job is what it is. I'll respect that they're doing their best, and if charges are to be laid, the appropriate officials will let you know, not the Premier.
And if I could ask a follow-up to Steve's question, you say that, your gut tells you that we'll continue with a high level of restrictions. When you say that, do you mean beyond December 11th, we could stay in code red and the restrictions we're in for the foreseeable future?
I think it's really important for Manitobans to know that COVID's a tough adversary, and it's not going to just quit just because, it gives up. COVID doesn't give up. And we're seeing that all across the country. We've got, Manitoba's not the only one seeing increased cases. We got a record number of cases, I think, in 4 other provinces on the weekend. Yes, we might be plateauing, but I would not want us to let our foot off the gas on making sure we're protecting our fellow citizens. We've lost a lot of people. We went from, as an example, Jeff, at the start of the month, we had 120 patients hospitalized. We're up to, yesterday, I think, over 330. Intensive care, we went up from 18 up to 44 yesterday. We've had care home outbreaks, as we all know. It breaks my heart when you see our seniors getting this stuff because they're so vulnerable, and in particular in our care homes, and we've had care home outbreaks. We went from start of the month of November, 355 cases in PCHs to 1,100 at the end of the month. So for anybody who is thinking this is a game, it's not a game. This is life and death, and this is real people we're talking about, and we have the chance to protect them. So let's get together and let's do it. And let's not let ourselves believe that just because there might be some vaccine available in a few weeks or months, that means that we're off the hook. We're not. We have an obligation to protect each other.
From City News, Mark.
Good morning, Premier. Just coming off of some of my colleagues there talking about this minority, whether they're divisions that don't want to do what public health is asking, or individuals who are in Winnipeg or Steinbach trying to start rallies. What could the government do beyond fines? I mean, if people are getting the fines, they seem to keep coming out. Is there stricter enforcement that could come despite the fact that we already have some of the strictest in the country?
Oh, I mean, there's other things we could kick around. The fact of the matter is, irresponsible people are with us, and the fact is that we have fines now to address that kind of behavior. I'm not a guy who gets into threats. The fact is, if you've taken $1,000 out of somebody's pocket, then that better be a deterrent, and if it isn't, 5,000 will be, and if it's a store and it does it again, you can close them. So the fact of the matter is, we've got more serious steps we could take if we need to. I just obviously hope and pray we don't have to take those next steps, because we're doing the right thing in making sure we have these rules in place, and we're doing the right thing in terms of enforcing these rules.
Thank you. Earlier on in the province, we were putting out the names of restaurants, or it seemed like we were being open about which establishments were getting COVID fines or experiencing COVID closures. I'm not seeing that those are being listed anymore. Is there a reason for that, or have I got that wrong?
No, I think there's the availability of those. I think they can be put out, and I think that's the intention. So, yeah, I don't have a complete updated list here, and I'm also careful not to list those who might like publicity as a consequence of the infractions. So that's another thing to remember.
From CHVN, Taylor.
Hi, good afternoon. At those churches, there were individual fines given out, and potentially more could be coming. Who was being fined? Is it the pastors, the attendees, or both?
I haven't been in the habit, Taylor, of naming individual people. I don't think I'll get into that habit, but I will say that I appreciate the work of the RCMP in blocking off the parking lot in one particular example. I think preventing people gathering is part of the intention. We're trying to get the message out there that we need people to stay safe, and if you can prevent the gathering from happening, that's probably better than going in and ticketing after it happens. So I do appreciate the work that the RCMP did on the weekend to prevent the gathering in the first place.
And we know about these two churches, but were any other worship places visited over the past week or so?
Again, Taylor, if infractions occur, we'll report them, but in this instance, I don't want to report on the activities of inspectors because that is actually not helpful in terms of the deterrent factor that we want to have. So the inspectors will do what the inspectors are doing, and we'll report on the results of those inspections, but I don't like to preview where inspectors have been because that may indicate where they might be going in the future, and that may assist those who would like to try abiding by the health orders.
From the Winnipeg Free Press, Carol.
Good morning, Premier. Can you explain what the rationale is for prohibiting drive-in church services? What's the problem with worshipers staying in their cars in a church parking lot when shoppers are allowed to stay in their cars in a store parking lot for curbside pickup?
Well, you're picking up a head of lettuce at the stores because we've eliminated the ability to sell anything but essential goods. I think that would be a pretty hard thing to prohibit. As far as the issue around parking lots, we did allow drive-in type services in the spring. Dr. Roussin and his team made the recommendation we go a little harder as of last week or 10 days ago, and so we have. But I think that's a good question for Dr. Roussin, and I would also say that clearly there are some issues that we have to address in terms of a couple of things that we'll be getting into in the next few days around clarity around what's prohibited in terms of occupational group and things like that as well. And also with respect of our support programs, there's some other issues there that I think we need to address to broaden our supports for some businesses that may not have been able to qualify for the bridge, the $5,000 support program that we've offered. There's been thousands that have, but there are some other businesses that might also be considered to be added there. So I guess what I'm saying, Carol, a long answer to your question, but I'm saying that some of these things need to be discussed, and there may be some ability to move on some of these measures in the next week or two before the 11th, when these orders have to be renewed.
And the owners of the Corona Hotel say that you unjustly accuse them on national TV of breaking the law for violating public health orders and would like you to apologize to them. Do you feel like you owe them an apology or would say sorry?
Well, if they didn't break the rules, Carol, I'd feel like I owed them an apology, but I don't feel like I owe them an apology. I like those people and I like their hotel, but I don't like them breaking the rules.
From Global, Brittany.
Good morning, Mr. Premier. Brittany from Global News. You spoke about the RCMP blocking off the ability for people to go to the church just outside of Steinbach this weekend. The church in Winnipeg, Springs Church, held 4 services over the weekend. Are RCMP, police, enforcement officers going to be looking at also blocking being able to go into churches on this upcoming weekend if churches are willingly going to continue to hold services?
I'm sure that our enforcement people, including the RCMP, will continue to enforce the rules as they are written. That is what their job is, and they're doing their job.
Thank you. We are weeks away from what the NHL says they want to be doing training camps. Have you gotten anything from the Winnipeg Jets asking about holding training camps here, and will that be allowed?
I think there'll be more to say on that in the not too distant future.
From the Brandon Sun, Colin.
Hi, Mr. Premier. Do you know how many, if any, instances there have been of people or businesses getting fined under public health orders and then had them revoked after further investigation?
I don't have any information on that at all, Colin. I'm sorry.
Okay. I was also wondering, last night you put out a statement criticizing the federal government for not bringing up health care during their fall economic statement. I was wondering if you wanted to expand any more on why you were disappointed, what you would like to see them address at your upcoming First Minister's meeting.
Sure. Yeah, I would say I also thank them for their additional supports. They've talked about it for quite a while, but they additionally committed to supporting small businesses, and I think that was good. So to be fair, I did congratulate them. But on the issue of healthcare, it's our number one priority. The present federal government committed in 2015 to a meeting on healthcare with the premiers. A week this Thursday, the 10th of December, will be that meeting. Manitoba's been leading the way on calling for a meeting to discuss health care funding because it's at the lowest level of federal support since the Canada Health Act was set up. And that was before COVID. Now with COVID, we have a significant problem on top of the pre-existing problem. So When there's no reference to specifically addressing that issue in the statement, then I'm naturally concerned that the federal government is going to try to kick the can down the road, maybe use COVID as an excuse and tell us all that they're going to do things to support certain items like billboard on personal care homes, or tell us they're going to invest in mental health. That doesn't remedy the reality of the situation that the federal government used to be a 50-50 partner, went to 25% and is now significantly lower than that and going south. So I'll continue. Manitoba has led the way on calling for a meeting, but also calling on action on the part of the federal government to be taken so we could protect our number one priority, which is health care. And I will continue to advocate for that to happen.
And our final reporter this morning from CTV National News, Jill.
Good morning, Premier Pallister. Just on that note, the federal government is talking about delivering vaccines. Do you think it should be up to the provinces or Ottawa to decide the order of who gets the shots, considering each province has unique challenges?
I think that it would be really helpful, Jill, if we had clear criteria from the federal government on who's going to get it and also who is going to deliver it. The who, what, and when they can do, we can do the where and how. We're happy to help, but I'll give you an example of where this is going to be a serious problem. Manitoba has the highest percentage of Indigenous people in the country. I asked the Prime Minister on our call last week, who's in charge of addressing the needs of on-reserve Indigenous people to get a vaccine? Who's in charge? And I didn't get a clear answer. We need to know that, because if it's the federal government, then when? When? Because half our Indigenous people don't live on reserve, but if a vaccine's made available on northern reserves before it's available in southern Manitoba, we're going to have an outpouring, a migration of folks naturally who want to get vaccinated up to northern communities, maybe taking COVID with them. This is not a plan. We need a plan. Conversely, if that who is that we're in charge, fine, then we can proceed immediately, and we already are proceeding on a number of fronts with our planning. But when we have, close to 1 in 5 of our folks here are Indigenous, it's awfully critical that we understand who is going to be doing that work. We need answers on that. The related issues, some of them are easy. I mean, clearly we need our most vulnerable folks, our seniors in PCHs, our frontline care workers, to get the vaccine earlier. We can all agree on that. But the devil's in the details when you get beyond that. Should it be done on the basis of age? Or how do you determine vulnerability? Should it be done on the basis of ethnicity? Should it be done on the basis of race in some way? These questions have to be addressed. And so I have raised this with the Prime Minister, with my colleagues. I believe there are a number of premiers who agree with me that and we're not saying the federal government has to do it all, but we're saying we need to have the criteria established, and the priorities should be common, not different on one side of Saskatchewan's border with Alberta than it is on the other, or not different than it is in Ottawa from Gatineau, but rather that we have a coordinated strategy. So I'm adamant that this is a very emotional issue for Canadians. The Canadians deserve to have some answers to these questions. This is lifeboat time. And we know that we can't have everybody on the limited number of lifeboats that are going to appear as vaccines come in limited numbers in dribs and drabs. That's what the federal government is expecting, I think. We're going to have a rush for people that want to get that vaccine right away. We better at least share with Canadians when they're likely going to be able to get that vaccine, because this is a matter of life and death, and there's not much more emotional than that.
And my final question, or last part of my question, is, we have the toughest lockdown measures in the country, essentially. We've seen Quebec, which is probably close to us. Since October, they've been in lockdown. Their numbers aren't dropping. Steve and Jeff alluded to this. Could we be seeing more measures for Manitobans to try and get these numbers down, or are we just going to have to live with, 300 plus cases each day?
Well, there's always a danger, Jill. I think in prognostication or forecasting, I can only say that I'm starting to see some indications of lower contacts for everybody who contracts COVID. That's a key indicator. And I think that, quite frankly, and this is not naive, I don't think. The Manitobans are abiding by these restrictions. I'm seeing reduced activity in terms of the contact incidents that would lead to COVID transmission, which tells me that our numbers will begin to come down. They've already come down relative to other jurisdictions. They're starting to come down, but in pure numbers, I believe that you will see in the coming weeks. Remember, it takes a couple of weeks, and those measures that we brought in, the most severe, were only 10 days ago. I would say, in terms of the what Dr. Roussin and his experts tell us, that it will take at least 2 weeks for these measures to start to pay off, and I believe you will see that in the coming weeks. But my message to Manitobans will remain: be on your guard. Do not let down. Once that curve starts to happen, we know it can also go the other way if we're not careful. And COVID is a sneaky, nefarious adversary, and it gets momentum, and we're in the middle of overcoming that momentum and making it go in the right direction in a downward curve. But it will take all Manitobans to stay on board. That's why we have these measures. That's why we have these deterrents in place. So we'll continue to do everything we can to protect our loved ones and make sure that people are kept safe. We'll look forward to the best Christmas gift of all, the best holiday gift of all, being lower COVID numbers in our province. Thanks, Jill. Thanks, everyone.